Hello, everyone. Welcome to today's CalMap Project Echo session on suicide prevention through lethal means restriction counseling. This is a heavy topic. We're very glad you're here to join us for today. But before we jump in, I thought maybe we could take a quick grounding moment just to bring yourselves fully here and to put off like all the stress of this morning, whether it was clinic or meetings or something else. Feel free to close your eyes for a moment if that's helpful. And let's just take a couple of good deep breaths just to ground ourselves here. I like to do square breathing. I think those of you who have been here before are familiar with it. You breathe into a slow count of 4, and then you hold for 4, and then you breathe out for 4, and then you hold for 4. Let's just try that a few quick times just to bring ourselves fully present. Sometimes it's helpful just to put your hand on your chest, maybe on your stomach. Just feel that air going in. Let's try that 1 or 2 more times. You can stretch a little bit. Just roll your shoulders if you need to, roll that neck. We carry a lot. It's good to let it loose once in a while. And again, just really glad for all of us who could make it today. You could just go ahead and take a minute, just drop a quick introduction into the chat, your name, the clinic you work in, county you work in. And if there's a one-word check-in that you have for today, please feel free to share that as well. Let's go ahead and move on to the next slide. So this is our final session of the Core Echo series. We are about to start our advanced series, and the registration is now open on our website. If you look in the chat, we're going to be dropping in the link to register for the advanced echo if you're interested. We'll be covering topics like PTSD and trauma, disruptive behaviors, eating disorders, among many others. And so it should be good. So I hope to see many of you there as well. Just a quick reminder that while this is a great place to come and learn through case discussion, didactics, you can always call us at this number for individualized personal help and coaching on your own patients, especially the ones that maybe have you up a little bit, have you wondering what to do next. Great resource. And finally, we do, not for the echo, but our webinar recordings are available on demand for credit. And there's the link there. You can get the credit by viewing the recordings and then passing a post-quiz. So that's just another resource we want to be sure that you're aware of. And let's go on to the next slide, please. So yeah, here's a reminder for the consultation, our QR code for our website if you'd rather drop in the consult that way or to call if needed. And a reminder, it's not just talking with our psychiatrists. You can also talk with our care coordinators and social workers for help finding resources in your area for your patients, because we know how hard that is to find the right resources in a timely way for our patients. So we offer that help as well. Next slide, please. And so just a quick sneak peek at some of the upcoming topics in our CME offerings. So we have a webinar coming up on trauma and PTSD on Thursday the 16th. Then on the 30th, we're going to be talking about self-injury, self-injurious behavior, and trauma-informed practical strategies for addressing that in practice. Our first advanced echo will also be talking about trauma and PTSD. Then we have our other echo series, including the school and skills-based, talking about social media use, as well as behavior management. So these all should be great. So hope to see you at some of those as you're able. Next slide, please. Quick look at our disclosures and our funders. And with that, I'd like to go ahead and introduce our speakers for today. We are really lucky to have with us Shelly Nakaishi, who's a certified pediatric nurse practitioner at UCSF Benioff Children's Hospital, Oakland, in the psychiatry department. She's been here since 2006. She provides outpatient psychiatric medication evaluation and management to children ages 3 to 21 in psychiatry and at the Castlemont School-Based Mental Health Clinic. She also helps provide consultation and education here with us at CalMap, including presentations like this one on suicide assessment in primary care settings and also on trauma-informed care. In addition, Shelly has also helped to co-create and teach a UCSF School of Nursing course on treating pediatric mental health conditions in primary care. Dr. Eileen Wang is an clinical assistant professor in the Division of Child and Adolescent Psychiatry here at UCSF. She provides outpatient care at UCSF Benioff Children's Hospitals, Oakland, and she also staffs our consultation line here at CalMap. She's an important part of our CME team as well, helping to develop all this educational content that you see before us. Her clinical passion lies in treating anxiety, depression, and trauma, and her research interests include medical education, PTSD, sleep, and the gut-brain axis. With that, I'll turn the virtual mic over to Shelly and Eileen.
Hi, everyone. Thank you for joining us and being here for this topic. Suicidality is so important and always kind of stirring up a lot of emotions. Today, we'll go over a few different things that hopefully can be helpful for your practice. Our learning objectives include first, understanding risk factors for suicide, and second, recognize lethal means restriction being an effective strategy to reduce suicide risk for teens. And then finally, we will learn patient-centered approaches to implement lethal means restriction counseling and also addressing barriers and collaborating with patients and families to implement lethal means restriction and safety plans through role play demonstration.
And before we begin, we know that this is a difficult topic and can bring up a lot of strong emotions for all of us. Many of us have had family or friends or patients who have died by suicide. And it can be difficult to process with our patients and for ourselves. Please don't reach out. Feel free to reach out and use CalMap for support for your patients. We recognize that every setting is unique with its own policies and procedures, as well as team roles and resources. And so this presentation really is intended to share resources and best practices, but all recommendations should be done with your supervisors, administrators, and stakeholders in each setting to address. Next slide. And we always want to start with a trauma-informed care approach because we know this is a difficult subject. And we want to be first aware of our own emotions and feelings when we're talking about suicide and when we are in clinic with our patients and families. A key part of this work is that we work together as a team. All of the crisis procedures should be team-based. And we also want to find and create space for connecting for ourselves and also connecting and our own self-care with this work. Next slide. A trauma-informed approach, begins with a very non-judgmental approach. And this is critical when we're talking about lethal means restrictions because we're going to be talking possibly about guns. And so we really want to go forth with a non-judgmental stance and talking about that. And we want to be able to give choices for our youth where possible as well as another example of being trauma-informed. When we're creating safety, first and foremost is that begins with confidentiality rules are clearly set up front. I like this idea of it's a universal process. So they're not feeling targeted, that when anyone is feeling suicidal or depressed, we universally make these safety plans in place and that this is part of our procedures. And we also want to think about how and when we would involve security and police in our crisis procedures. The other part of the trauma-informed language is to use, someone died by suicide, death by suicide. We don't want to say they committed suicide. We want to avoid that. The other one is we just want to use it was a suicide attempt, even if it was in the past you might have seen or heard it was a suicide gesture. We don't want to say it was not a suicide attempt. So those are some language areas. When I do this, Eileen?
Yeah. So continue with the agenda for today, and then we are gonna go into details about lethal means restriction counseling, and then followed by a role play.
Okay, so it's about a 13-year-old who discloses to you, the provider, they're feeling suicidal and they plan to overdose using their antidepressant medication. So what kinds of things more do you want to know about this 13-year-old? If you could put in the chat just some other questions you would want to know that come to mind. It could be about risk factors, protective factors, anything around this assessment. Right. Key, critical, and why we're here today talking about lethal means. Do they have access to it? Yes, suicide history, past suicide attempts are critical to know, and maybe how they and what they used, and how intense is the suicide feeling. Right, we want to know both the protective factors. Do they have a support system? That's critical for part of the safety planning. Exactly, more about their suicide plan and intent, because that's critical to how we're going to figure out how do we streamline our approach in thinking about lethal means restriction. And have they done any actual behaviors, any collecting of any things and preparing? Those are called like suicidal behaviors, is the preparation. A lot of and we have other talks and webinars that go more into suicide assessments, but we just wanted to get your mind starting to engage in all of the things that need to be asked. But today we're going to focus a lot just on the lethal means restriction, because that is a highly preventative and a major suicide intervention. Next slide. And why this comes to mind is, most efforts to prevent suicide focus on why people might want to take their lives, but we understand more and more about people that die from suicide are actually, it's how they attempted to die. So if we can prevent them from getting access to the lethal means, we can prevent death by suicide. Next slide.
We're gonna focus a little bit more on the lethal means, as Shelly mentioned earlier. And it's just really important to learn more about what it is and how it becomes important. Suicidal ideation often is short-lived, and most attempts happen impulsively within 10 minutes or in the first hour, and it gradually dissipate after that. So during this critical window, having access to lethal means can really make a difference between life and death. Firearms are actually the most lethal and also the most common method for teenagers, followed by suffocation and medication overdoses. So these are usually the top three items that we will go through with teenagers and parents. Just like we will go over car seats, helmets, seat belts, these type of education can really protect teens who are at risk. 90% of people who survive a suicide attempt do not go on to die by suicide in the next 12 months. So that's why reducing access to lethal means in the moment when they're impulsive and being very emotional is so effective. Studies also show that caregivers who receive counseling about lethal means restriction are a lot more likely to actually implement them. So that really shows us that the parents are open to learn, it's just that they often don't know about it and there's a lack of knowledge. So that's why this is not very prevalent just yet. From another study also shows, although this is a sensitive topic, close to 50% of parents who received the survey actually reported that they're interested in learning more about lethal means restriction, with only 7% of parents reported that they're upset about this topic. Next slide, please. So following our talk about firearms, it is the rate is on the rise by 1% per year as a popular method for teenagers to use to harm themselves. This trend is especially concerning among certain populations, such as American Indian, Alaska Native adolescents, who experienced the highest absolute increase in firearm suicide in the past decade. About half of all youth suicides involve firearms. And in almost 80% of these cases, the firearm belonged to a family member. They don't belong to the teenager. And they're mostly not stored safely in the children's home. Safe storage of firearms is critical in preventing these tragedies. Firearms should always be unloaded. They should always be locked in a secure safe with ammunition stored separately. Research shows that safe storage education and lethal means restriction counseling are the most effective ways to reduce suicide risk. And lethal means counseling, especially focusing on providing education around firearms, is a way to effectively reduce the risk. If we have a deeper dive to look at the suicide rate disparity, as I mentioned earlier, the trend has been going up every year from 1999 to 2020 by 1%. And you can see for the American Indian and Alaska Native population is particularly high in terms of the rate of increase. Next slide, please.
So I wanted to take like a simplified view of like when I'm in the moment and I'm doing my, assessment and my lethal means restriction, I wanted a simple way to think about how am I going to do this? And the first part is like, what is their plan? How would they kill themselves? And I want to gather as much data as I can, like a detective, in finding out all the details. I also want to know about past incidents that they may have used. That is my data collection. And then I want to find out, have they started to do any of this planning? What have they started collecting or mapping out or identifying? Because that is, again, going to be how I'm going to go back and do the lethal means restriction counseling as the next step with the parents and caregivers. And then most of the time I'm doing that collaboratively with the youth and the caregivers all together. But then I may need to meet separately, of course, with the caregivers and talk about more specifics and details. And the other part is with both parties, the youth and the caregivers, I want to make sure I ask them specifically, do they know about any firearms in the house or close to the house that they can grab, that they can have access to that. And then I ask also the caregivers as well. And then I may ask the caregivers alone without the youth there again. So because that is the most lethal means. And weapons could also be part of that, not just guns. They could be hunting with bow and arrows. And then the last part is in my mind is how to be so specific. I think that sometimes, we might just say we ask these questions, do you have a gun? Or yes, you're going to lock up the meds, but we actually want to get even more finer detail. When will you lock up these medications? Where will you do that? Who will do it? How will you do it? And we want to be really specific. And then we want to document that in our note, and then generalize it in the safety plan and have that. And we'll role play this out as to how specific we try to get. This slide kind of walks us through at a high level the process, which is, you're meeting with the young person alone and you're gathering the suicide assessment information. And then that helps you focus how you're going to do your lethal means counseling separately with the youth. And you're going through all the things that they've been thinking about how they would do this are collected and their plan. And then I'm going to do my collaborative safety plan with the youth alone and make sure I know their other risk factors. Are they using substances? Do they have a coping skills? Do they have a support that they talk to? And I'm going to make sure I get all that data and put that in the safety plan. And then I'm going to, at the below, I'm going to meet with the caregivers and the youth and ask them their awareness of any mental health concerns, and then inform them of the suicidal ideation and plan of their kid, and then really spend time with trying to kind of validate their concerns, understand their understanding of what this means, or any myths that they might have to demystify them. and do a lot of education and support. Then I'm going to do lethal means counseling with them and make it sure it's very, very specific. And then I'm going to go back and also update the safety plan as well. So it's kind of a high level walkthrough. Next slide. And this slide is to kind of show some of the resources that UCLA has done is this Lock and Protect, and it's an interactive website that you as providers can look at because it gives you great ideas and information because different states have different laws about how to secure guns. Or gives you different options like and ideas around guns. Like you could probably stare in some places you can take it to the police station. In some places, it's a pawn shop, and it tells you which ones cost money or doesn't cost money, which ones are safe, like different secure locks for guns. And it walks you through and provides counseling. But the families could do this themselves, and they can get counseling information about the facts and ideas on how to restrict access to lethal means. So check it out if you haven't seen it, Lock and Protect. And I'll put this in the website too, though. Then the other one is a free training that AAP has indicated, as well as Zero Suicide. It's called Calm Training, and it really walks you through how to do lethal means counseling. And the big emphasis is how to be non-judgmental and talking about things like gun safety. But it uses a lot of motivational interviewing approaches.
And we want to save some time for our role play, so I'm just going to fly by the next two slides. This is just a list to show you all of the things that you can talk about during lethal means restriction counseling. It may feel exhaustive, but also I try to use language such as this is what I share to with every teenager and parents who have suicidal thoughts or plans. We take your safety seriously, and this is something backed by research that we know can be very effective. That's why I'm sharing it with you. So kind of generalize it and normalize it and really emphasize that I care a lot about your safety. And this is something that we do know by research that is very helpful. Next slide, please. So finally, lethal means counseling is a vital part of safety planning. So it's a crucial part of a bigger plan. And on the right, you can see that this is just a template. You can feel free to use whatever template that you have or you prefer. But usually a safety plan includes warning signs, documented coping skills, any personal or professional supports, referrals, resources, and crisis numbers. And then finally, lethal means counseling, making sure that we have gone over this part with both the teenager and the parents, and also addressing social media safety if the teen is active on social media. And then I think we can go into our role play to see how to go over these components in a quick visit.
Okay, so we're gonna let me get my other thing up. All right, so this is about a 13-year-old youth who we'll refer to as E, which will be Eileen, and they've expressed a plan to overdose on their antidepressant medications. They've actually been collecting the pills by pretending to take their meds. Um, and this is something that is common. And, that one picture slide that we had of all the different types of lethal means restrictions of the boxes. Um, I just like a visual picture to kind of show me of all the different things that have we've come across when we're doing lethal means counseling. But so I'm going to be the provider, and Eileen will be E. Okay, so here we go. Thank you for sharing with me, E. I know it's been really hard, and you've shared these feelings, and you've been really honest with me. And you've mentioned that you've been collecting pills by not taking them for a few weeks. I understand this is really overwhelming, and things must feel for you right now.
Yeah, it just feels like this may be my only way out.
I hear this, you're in a lot of pain, and I want you to know that your safety is my top priority for your health and well-being. And part of my treatment plan is to inform your parents so that we can all work together to keep you safe and to support you. In times like these, all families are instructed to do this type of safety planning.
But I don't want them to know. They'll freak out.
I understand you're worried, and I want to let you decide if you want to tell them yourself or with me here, or if you want me to tell them. I'll explain everything to them in a way that's focused on keeping you safe and supported. What would you prefer?
Can you just tell them? I just don't want to talk to them about this.
Okay, that makes sense. I'll have your parents come back to join us shortly. I also need to ask you something more. Do you know if there's a gun or any other weapon in the house?
No, I don't think so.
Okay, thanks for letting me know. All right, now I'm going to be talking with the parent. Thank you, Mom, for coming in. I want to talk to you about something important around your e-safety. They've shared with me that they've been feeling suicidal and overwhelmed, and they do have thoughts about taking their antidepressant medications, an overdose. And they've been collecting their medications by not by pretending to take them. And I know this is really, really hard to hear, but we're here to support you and we're here to keep E safe.
Oh my gosh. Oh gosh, I have no idea. What do I do?
Okay, the first step here is we have to secure all the medications you're in your home. And by mean all medications, I mean all of the over-the-counter medications, any adult medications, any other children's medications, or grandparent, any meds that are in the home or that they could have access to. If they even go to their grandparents' house quite often, then we want to think about securing those as well. We often recommending, buying a toolbox and getting a padlock for it. There are med locks boxes, but they're quite expensive. Um, and would you be able to get one of these today?
We don't have anything like that in our house, but I guess I can get one, something like that in Home Depot, right?
Yes, that's great. That's a great place to go get it. When do you think you could pick one up and have this set up? And hopefully today.
I can do it this afternoon.
Okay. In addition to the medications, it's important to remove any other dangerous objects, sharp objects, including knives, scissors, razors, safety pins, nails, and needles. Other potentially items include ropes, extension cords, belts, alcohol, recreational drugs, and cleaning products. I know that's a lot. We'll give you all this information too. And we really, we want to take time to carefully go through the entire home, including the garbage, the basement, the tool shed. These items should either be locked up securely or ideally removed from your home altogether. And we want to, this is really a family effort because we might miss things. So, working with another adult to help you go through the house. We know teenagers are impulsive, and research shows that a suicide attempt actually um, often attempts occur within 10 minutes of a suicidal thought. So if we can like safety plan and baby proof the home, you know, like you did when they were babies, we locked things up and kept things away from them. The same idea for a teenager, especially if they're suicidal or depressed. Um, and this is just a process we use to reduce risk and create a safe environment for them.
It does feel like a lot to do. I almost feel like it's impossible, but that makes sense. I haven't really thought about it that way.
Um, so I also want to double check, do you have any firearms in the home?
No, we don't have any guns.
Okay. If that ever changes, please let me know. And we have resources and information to provide on how to keep your guns stored safely if you need them.
Sure.
Another important resources I like to give out is the poison control number. If there is an overdose or ingestion, that's the number to first call. And it's the 1-800-222-1222 number. And we'll put this in a printout for you too. And let me ask E again. Do you currently have any pills or medications hidden that I haven't asked about right now?
Yeah, I have a pill box in my backpack.
Okay. Let's make sure we collect those together right now before you leave. And then tonight, let's have your parent go through the room and backpack in other areas where you might have any hidden pills. Um, I know it sounds extreme, but we're really trying to just make sure you keep safe. And we're going to also ask your parents to check that you swallowed the medications um, while we're in this period of time. And that we're going to ask your parents to randomly go and check your room or backpack, just part of the safety planning. I know we're invading your privacy a bit, but we really are doing this for safety planning, and we would ask all families in this situation to do this.
Sure, I can do that for E, and I'll make sure that everyone is secure from her.
Okay. Um, I we're here to support you. If you have any questions or any things that come up, please call me back.
Thank you so much.
Okay, that was probably 5 minutes, right?
7 to 8 minutes.
7 to 8 minutes. All right, official timer, Eileen. Thank you. All right, next slide. Um, so I know that was a lot, but we were really, talking it through and practicing it, and it has helped me over the years. And so one of the key challenges I think we have is how do we balance our own stress, but balance compassion with not making this feel like a punishment to the young person. How do we be very realistic and achievable and making sure we can do this lethal means restriction without freaking out people, the caregivers and the youth. But what we really know is that if we restrict lethal means access, we can save lives. And this is a critical part of suicide prevention. I think by being very non-judgmental, matter of the fact, having a very universal approach, equating it to like we wear car seat belts to keep us safe. This is just another example of anticipatory guidance of how do we keep people safe when they're feeling suicidal.
Great. Thank you so much for this great talk.